What I really don't understand right now, though, is why we've been told that we're on a one-way road to freedom by the 21st of June. That's what we were told, weren't we, on the 22nd of February, by the way, about 7 weeks after we went into lockdown, that we were on that one-way road to freedom. And it was data, not dates. Trouble is, though, even when the data's really good, the dates don't come forward. And sometimes we're told they may be pushed back. We were told that the vaccine was the way out. We were told the vaccine was the answer. Matt Hancock in early January, just days after we went into this lockdown, said that the vaccine rollout for the most vulnerable, over 70s, one jab would see the return to the start of normal life. Cry freedom, he said, is what he would be saying by now. First, it was the most vulnerable, over 70, getting one jab. Then it was over 50s getting one jab. Done my bit, thank you. Then it was everyone over 50 getting two jabs. Now it's every adult over 18 getting two jabs. Then it's going to be every child getting two jabs. And then it's going to be the autumn and we'll have booster jabs for everyone. When does this end? The vaccines work, the rollout has been amazing, and yet we still do not have a return to normal life. So I wonder when we're going to get that. Well, let's put some of those questions to my guest at this time. Jonathan Ashworth, the Shadow Health Secretary. Good morning to you.
Hi, Julia.
Hi, lovely to talk to you. It's great to talk to you. It's interesting that the Health Secretary won't come on the show anymore, neither will his ministers for some reason. So it's nice to know we've got some, at least shadow ministers who've got a little bit of backbone. So we appreciate you coming on and joining us.
You always give us such a hard time.
I do.
Julia.
I'm very fair and honest with all of my interviewee guests.
It's absolutely. It's quite right. I mean, as politicians are supposed to be held to account. I mean, you won't always agree with me. Obviously, you probably rarely agree with me. But the whole point is, you're supposed to hold us to account and ask us the questions that your listeners want putting to us.
Exactly, and thank you very much for coming here to do that. Let's ask you some questions then. When Boris Johnson talked about getting back to some semblance of normality, did you think that normality meant people taking 2 tests a week, wearing face masks in supermarkets, in schools, on buses and trains forever, needing a vaccine passport to go to the cinema and having to social distance in pubs and restaurants? Is that what you thought normal life would be?
Well, let me just sort of answer that in a slightly complicated way. First of all, I thought Boris Johnson was being dishonest with the British public when he said we'd all be back to normal this June, because I always thought that there'd be some things that would have to remain in place, such as face mask wearing, perhaps on public transport. I know you're going to disagree with that, but I've always anticipated that something like that would continue. What I didn't think would happen, and I am surprised at, is that his proposal, which he couldn't actually defend last night, even though his own document is his proposal in his own government document, is that he is going to allow pubs and non-essential shops, presumably things like H&M and Next. He's going to allow them, if they want to demand that people who enter demand in order to gain entry that people provide a kind of digital ID card showing their vaccination. And I think that is unfair and discriminatory. So whereas, I think I've always expected that we'd probably have to continue wearing masks, and we may well have to continue to try and distance a bit on public transport. I anticipate you'll disagree with me on that, but I've always anticipated that. Why is he now saying that, you're going to have to produce this sort of app on your phone in order to gain entry to the Dog and Duck if the landlord of the Dog and Duck decides that's the condition for entry?
Well, this is it. The vaccine passports is a very big issue, isn't it? Because we've never had ID cards in this country, very different from many of our European partners where you can be, any official can request your ID at any time. We don't have that. There was a big campaign against that some years ago, and Tony Blair wanted to bring it in. Now, Keir Starmer, your leader, has said basically it's against British instincts, basically un-British, this idea of, papers, please society. We've been promised by Michael Gove and now by Nadhim Zahawi, the vaccine rollout minister, that there will be a vote in Parliament on this issue. We know that 71 or 72 MPs, including 41 Tory backbenchers, the COVID recovery group, and Liberal Democrats, and many Labour backbenchers, including the former leader Jeremy Corbyn, have said they would vote against vaccine passports. What is the Labour Party as a whole going to do in terms of the parliamentary party led by Sir Keir Starmer? Will you vote against vaccine passports, and will you tell us that now?
Well, let's see what the government actually produce in
Why,
terms of
why,
the
do, why
legislation.
do you have to wait to see that? It's a matter of principle, isn't it? In which case, it doesn't
Well,
matter what the detail is.
because I want to see exactly what is produced in the legislation, because it is a matter of detail. Because, for example, when Leicester play Southampton in the FA Cup semi-final at Wembley, and I'm very hopeful that Leicester win that and get to the final, obviously, I can imagine that you'd want, if you want to get more fans into that stadium, that you'd want to test people, ask them to take out a lateral flow test in order to get in. So you do need something in place for these big mass gatherings. I
Why?
believe
Why?
because I think because there will still be virus circulating.
Yes, like there is flu virus as well. Why we don't insist people have a flu test before they go to a football match?
Yeah, but
Outdoors, a football match, why with very low prevalence and the vast majority of people vaccinated, including virtually everybody who's remotely vulnerable to getting hospitalised or dying, why would we need to have testing of healthy people?
Because while we're still learning about how to respond to this virus, I think that is a sensible
Why is that
precaution.
sensible? Why is it sensible?
Because because if you sit next to somebody at Wembley Stadium and you are close by, and you're probably, and if you've got it, you're probably you could well infect the four or five people sat around.
Do you know what? I mean, you're the Shadow Health Secretary. I'm guessing you know an awful lot about this. Do you know what the rate of the chances of percentage by chances of someone, if I have COVID and I'm at home with my family, do you know what the chances are that I'll pass it on to a member of my family?
Well, there is a reasonable chance.
Do you know what? No, do you know what? Do you want to know? I mean, living indoors 24/7 with my family. Do you know what the chances are?
What? Well,
38%. So, what do you think the chances are of someone outdoors sitting next to someone in the fresh air for an hour and a half?
Well, the chances
virtually zero.
The vast amount of transmission takes place indoors. Of course it does. Of course it does. But
when was the last indoor football match you went to?
But you're still sat next to somebody on a plastic chair, close up to them, cheering and shouting and cheering on Leicester City when Jamie Vardy scores. Look, right, the point is, I think you should still be cautious. You should still be cautious.
Well, maybe the people who are cautious could not go to the football matches then.
I don't think it's unreasonable. I mean, I'd be quite happy if I could. I mean, I probably won't be able to get. But if I got a ticket to go and watch Leicester City play Southampton, I'd be perfectly happy to take a test to go to the. I don't think it's that I should have to provide my vaccination.
Jonathan, I'm just saying, the sound is going in and out, and there's now a little bit of I don't know what's quite happening, a little bit of an echo. So we're hoping we can sort that out with the, I don't know whether your earpiece or something is butting in and out, but we've mostly got what you had to say. I don't understand why you think that a vaccine passport is somehow ethically not right on, but proof of a test is. What other things should we test for? Because now we're looking at, well, maybe we won't have to have vaccine passports to go into a pub and to go into a restaurant immediately. Well, that's because they're probably going to reopen long before these things are available. But it'll be up to landlords. So one landlord would be told in one restaurant, say, you can actually make a living. You can actually make a profit by having more tables and have people not socially distancing, not wearing masks, and test and have vaccine passports or tests. And the other pub, if they refuse to do that and they don't impose that sort of a limit, then they can't. That is effectively forcing the hand of any publican or restaurateur who wants to be able to remain in business to agree to vaccine passports. That's effectively coercion of those businesses, and it's effectively coercion of the population to have a vaccine or they can't take part in public life. We agreed, did we not, as a nation, that we wouldn't do that?
You are right. Your analysis.
Well, I mean, if we could just start from that on every single show, that would make life shorter, wouldn't it? I mean, be simpler.
I mean, your analysis is correct. And fundamentally, I do not support compulsory vaccination because I think in the end, it is counterproductive. If you want to drive up vaccination rates, you do it by persuasion. And we do have, sadly, pockets of the country where vaccination rates are still below the national average. Sometimes they coincide with infection rates above the national average, and we need to invest in those areas. We need to invest in the public health and primary care teams in those areas in order to drive up vaccination rates and drive infection rates down. So one of the things I've been pointing out today, I know it's not the headline issue, and I understand that, but one of the things I've been pointing out today, that in many parts of the country, like Hartley-Brewer, like Wakefield, like Kirklees, the public health budgets have either been cut on a head-for-head basis or been frozen. And yet these are the teams who are responsible for driving up those vaccination rates and driving down infection rates.
Okay.
And I think unless we invest in primary care and public health locally, we won't get on top of this virus. That's how you do it in the end.